everyone. Today is Saturday and I get the weekends off, so that's good. Today I have a really bad headache. You can feel it right in here and kind of like behind my eyes. And I get these a lot. I would get headaches occasionally before I was diagnosed, but I started getting them really bad after I started Plaquenil. Because originally I was taking 2 Plaquenil pills a day, and this kind of headache that I have today, I was having all the time. It wouldn't go away no matter what I did. So the rheumatologist told me to go down to 1 Plaquenil a day. And it did help for a while. I noticed the headaches lessen, but now they're still coming back. So I don't know if it's caused by the Plaquenil or something else, but these headaches are really bad. I get them every day pretty much. I usually wake up with the headache, or when I leave for work at 10:30 in the morning, as soon as I go outside, it's like the brightness of the sun just brings on the headache. And then it kind of like comes and goes throughout the day. Like I might have a little bit of relief for a little while, maybe like an hour or so, and then it comes back again. And there are some days that I don't have the headache, but for the most part I have this headache every day. And it really sucks. And I take Tylenol for it, and sometimes the Tylenol works and sometimes it doesn't. But anyways, I guess that's part of lupus. And another symptom that I've been really dealing with a lot lately is getting short of breath. Right now I seem to be okay, but if I do a lot of walking, like a lot of times in the morning, just walking from my house to the bus stop, which is about a 5-minute walk, sometimes not even that. By the time I get to the bus stop, I'm really out of breath, and I don't even walk that quickly. And the humidity doesn't help it. It just kind of adds to it. It makes it harder to breathe. And you know, just climbing a few stairs is brutal. And so I had a breathing test done, and that showed some abnormalities. And I can't remember if I mentioned that in my story or not, but on Monday evening, I'm going to have a CT scan of my lungs. And once those results come back, I guess depending on what they show, the rheumatologist is probably going to refer me to a respirologist, she said, to look at my lungs more. So I'm really hoping that something can be done about that soon, because the shortness of breath is getting really bad. I mean, there's sometimes where, like I said, I'm a nanny, and the little boy I look after, you know, he has his lunch, and right after he finishes his lunch, I, you know, just have to rinse off his dishes, put them in the dishwasher, wipe up the table, and then we walk literally a few steps to the living room. And just from the movement of putting the dishes in the dishwasher, cleaning up the table, and then walking to the living room, by the time I sit down on that couch to read him a story before his nap, it's hard for me to get through the first couple of sentences of the book because I'm trying to catch my breath. And so I have to keep pausing when I start reading him the first story. So it's getting pretty bad, I guess. So I'm hoping that they find out something soon so that I can have some relief from that. Just going back to the effects of prednisone, I was going to try and show you my shaking. It doesn't seem to be too bad today, but if I show you, for example, when I try to squeeze our ketchup bottle. I'm not actually going to squeeze it because that would make a mess, but like I'll pretend like I'm going to, and you'll see how my hand starts to shake just from trying to squeeze it. You can kind of see the bottle is shaking. I don't know if you can see that. So, and that will happen sometimes. It also, if I'm like, say, trying to lift a heavy pot of water, I have to use two hands, and even with two hands it'll shake. And even sometimes just lifting our milk jug to pour it, my hand one time was shaking about like that much when I was trying to do it. Some days it's worse than others. And then I can always feel it shaking a little bit, like maybe about that, when I'm eating. So that's from the prednisone apparently. That's what my rheumatologist told me, because it can cause muscle weakness. So that really sucks. And another thing I've been dealing with a lot lately, especially yesterday, is, and this has been going on for months and months now, probably even a year, I get a lot of pressure in my left ear where it feels like it's plugged up and it hurts, and sometimes I get it in my right ear too, but it's mostly my left ear, and it'll pop a lot, and then on top of that I get a lot of like a post-nasal drip, I guess, and phlegm, and I'm always having to clear my throat, which probably doesn't help this hoarseness. It probably adds to it. And then I have the hoarseness. And so, you know, I've talked to my family doctor about it on several occasions. He's checked my ear, he hasn't found anything. And the rheumatologist isn't too sure, but I was asking about being referred to an ears, nose, and throat specialist because, I mean, I don't think the hoarseness is from acid reflux. I know what acid reflux feels like, and I don't have it. So I'm just hoping that something will be done about that soon. She said she wants to investigate my lungs first because that's more important. And then she might send me to an ENT. So hopefully, again, something will be done about that soon, because I was trying my best to sing last night, and I was having fun singing, but I almost lost my voice, and that's no fun. I used to be able to sing for 2 to 3 hours straight without stopping, and I wouldn't be remotely close to losing my voice, so that's really annoying. And getting back to the prednisone as well, the reason that they have to wean you off of it, you can't stop it cold turkey, because if you do, you'll have like withdrawal effects, and it can also deplete your adrenal gland. Like your adrenal gland might not work properly, and that can cause a whole bunch of problems with your health. So they have to really taper you and wean you off of it really slowly. And you know, just a good example of how dangerous it is to just miss even one dose of prednisone. When I was admitted into the hospital a few weeks ago, when I was still in the ER waiting for a room, even though I hadn't vomited that whole night, the next morning they decided to give me my prednisone via IV, because they were afraid that if they gave me it in pill form, like I've been taking, that if I vomited, it would come up, and then I wouldn't have the dose in my body, and then they were afraid of my adrenal gland being affected. So they had to give me my prednisone IV the first day, just to make sure that it stayed in my system, because even if you miss one dose, it can really do a lot of bad stuff. So I guess that's it for today. There's really not much else to talk about. I'm going to try and do some of my art, but this headache is pretty bad, so I might just end up laying down for a while. Anyways, I guess that's it, and I will talk to you on my next vlog. I don't know when that'll be, but whenever the mood hits me, I guess, and if there's anything important to talk about. Take care. Bye.